social inequality in this scenario of COVID-19. And we have the pleasure to have PAHO to organize and to place you all in a close cooperation in a very important work with the network of the Americas and the scientific community as well. I take this opportunity to send you a very nice greeting from our director from PAHO and our sub-director, Mr. Espinar, who send you best regards and are also following this meeting for the importance of this seminar in the construction of an agenda for the medium and long term in the work that we develop in the countries and institutions of our region. I would just like to take some time in this seminar to give you a reflection on something that it's undoubtedly in the center of what we work permanently from our institutions and our bureaus. The first one is to recognize that the Americas, this region is one of the most important in the world that represent very large inequalities. We have an urgent need to fortify the institutional capability to measure and monitor the inequalities in our countries, in our sub-regional and regional components. But not only this measuring and monitoring is important, but also to relate it with the factors and decisions that are part of these efforts toward health and to have an approach that is going to allow us to identify solutions and to take measures not only in the description of the problems, but the acceleration of all the systematic actions of the components of the government and the society, considering all society in order to increase equality in health in our region. This seminar has the objective to set up some of the key elements in this construction of an understanding and a shared agenda that is going to allow us to understand the analysis on the problematics and to build in the future key elements in this articulation within evidence and solution. We have great panelists with us today. Dr. Rocio Sanz, who's going to direct us, who's going to take the floor for a minute in the Americas. And I thank Rocio very much for all this work that she has developed and toward the organization of this seminar and many other. Dr. Sáenz is a doctor in Costa Rica and president of the Social Security in her country. She's the executive director of the network. The first panelist in the component of presentation and discussion in this seminar will be Dr. Oscar Mujica, who is our regional assistant, and Dr. Mujica is our assistant for epidemiology in the PAHO, and also the regional office for the WHO in Washington. Oscar has been with us since '97. He's a surgeon, a specialist in epidemiology, expert in public health. And in PAHO, Oscar is leader for the programs for health. He's a leader of these programs and has a lot to do with the implementation of programs in our country. The second panelist is Dr. Ana Sojo. He's independent from Costa Rica, expert in protection, inequality, poverty, and health policies, doctor in economic and social sciences, master in sociology in the University of Berlin, and has experience uh, in the CEPAL, where she has had time working with. She's over in the Institute of Development Science in Central America and sociologist from the University of Costa Rica. Our third panelist is Dr. Jimena Avellaneda, Master in Psychology of the Education in the Columbia University in New York, partner, founder, and researcher for 45 years in the group of studies for women in Oaxaca and the Center for Community Leading roles and the lines of action of her work include gender equality, health, maternal health, sexual and reproductive rights in young people, gender methodologies for training, uh, programs for health, justice, human rights, and higher education that we mentioned. At this moment, she is part of the civil society in Mexico for the America's Network for Health. With these extraordinary panelists, I would like to simply recognize that we have in what is going to be the main point of this seminar, and it's your presence. You are experts in many areas and you are engaged with this subject. You have great interest for research, for action, and also in the governmental areas. I recognize the presence of colleagues from PAHO, our director, Ms. Roses, a representative of countries. I see colleagues from the technical departments and you all. I thank you for your presence and I invite you to have a great session, not only in the content, but also for the discussion that we will be able to develop around these panel presentations. We are going to have this permanent reflection during the seminar, and I would like to ask Dr. Sáenz to give us a message, a welcoming message. You all be welcome and good morning again to all of you. Dr. Sáenz. Thank you very much. Good morning. Good morning for this introduction and this presentation. Today, we are very happy to be able to start with this process. As you mentioned, is a process that began with the concern and not only to discuss and analyze the problems of equity and inequality and its different expressions in the different population groups, but also to identify which are the actions and interventions, programs, policies that we really want to take us toward a better equality in the Americas. From this perspective, I would like to share some ideas that I have here in my presentation. I don't know if I am authorized to download the presentation at this moment. Can I do that at this moment? As it has been mentioned, our presentation is going to cover the health equality in the Americas, and I would like to present to you the work that we have been developing in the equality network in the Americas, in which we have been working very articulately, in a very articulate way with the PAHO with Dr. Sebastian Garcia and different professionals in the region who are interested in this subject of equity. Some of those who do not know us, we would like to, that we are a platform, a multidisciplinary platform where several areas of expertise interact, also in training, social action with diversity, on the strategic visions and the policies at multi-level, at local, national, regional, and global levels. Within the thematic areas that we develop, we can mention the impact of the pandemic in the different vulnerable groups, the interventions in public health from these social determinants, and the populations on the streets and human rights, integral attention for pregnant women, the situations in front in borders and migration, and integrity in health. Our directive council is formed by experts very well known in the region, people who have worked in research. We'll start with Dr. Amy Ritterbusch in the University of California. She's a researcher, especially on equity in homeless people. Dr. Manuel Urbina, National Academy of Medicine in Mexico, very well known in his country for his work in the region, and he represents and is in the Academy of Medicine in Mexico. Dr. Arachu Castro of the Tulane University, she's from Spain, but works in this university, and has to do with subjects of women and children in the region. Dr. Pedro Mas from the Institute of Tropical Medicine of Pedro Curie in Cuba. He is a researcher, member of the Health Academy in Cuba, and he's part of this directive council. Dr. Jimena Avellaneda, she was previously presented or introduced, and she'll be a panelist in this session. Dr. Carlos Cáceres from the Peruvian University, Cayetano Heredia, and Carlos has a great trajectory in research for HIV, and he's a doctor in research at this university. And finally, Dr. Luis Galvão from the Osvaldo Foundation Cruz, Osvaldo Cruz in Brazil, very well known for these subjects related to environment, health, equity, and other um, equality. And he's well known for most of us as Pudo. In this moment, we would like to show you how we have advanced on the roadmap. And today, starting with this first step in the region in a very collaborative way, and obviously trying to articulate a vision, an agenda, a strategy, and some points where we can advance in the region. The roadmap, the office in Europe uh, published status support in '89, and this initiative looks to put the equality in the center of policies. PAHO aims to prepare the regions to make an effort in this sense. Also, the recognition that was already presented by Dr. Garcia on the mapping and the availability of the information sources, the systematic monitoring of inequalities, and the interventions for a dignified life. So we received these presentations at national level with experts in different themes, and this type of webinar, the first one we're having today, to see the level of inequality of health in the Americas, and how we are responding to this objective or target. We are responding to the basic levels of what we have called the equity drivers, and this could be ready by the month of October, and we will be sharing with you all the advances and dates that can be developed. So with this, we would like to reach a satellite session that we would like to have in Colombia, and the meeting that will take place in Bogota of the HSG 22 to present all these actions and also to visualize the permanent discussion in a constructive way for health in the region of the Americas, trying to identify not only the actions on these equity drivers for the design a policy pro equity at level of the region. And this has lines for action. We will also develop some documents, and we will be presenting so that in 2023, the continuation of this work could advance in several subjects such as the impact in the equity politics, governance, and equity from local government stratification and the institutional integration and equity, and also the methodology of treating this subject. We are very inspired people, and at the end of this process, we would like to have a document, a book, a systematization of all this experience in which you all who accompany us today, all the researchers, directors, service providers, and other will help us reach these objectives that we have set for us. These would be then my inauguration words for this first session, and thank the panelists that are with us today. Thank you very much.
Thank you, Dr. Science, for your kind words for the framework, the general framework of this intense work. Not only this seminar, but it has a very intense route in all the region. They asked me to clarify or remind you that there is simultaneous interpretation in English and Spanish available. You find it on the interpretation icon on the Zoom platform.
Remind you, we have available translation services at the bottom of the Zoom platform. Under interpretation, you'll find the link to Spanish and English. Y también tenemos interpretación.
We also have sign language interpretation where there is an open presentation. This goes to a secondary screen that will be available where we have the views, including more participants. So if they require it, as a matter of fact, I'm not seeing it. I would like to see whether we have active yeah, good morning. We really leave each 20 minutes, but we don't see your screen.
Ya lo vemos.
Okay, we can see it. I would ask our technical support to open the screens and to use the proper screen. With this, I go to the last point that I'm asked to present to the participants, but I didn't introduce myself. I'm Dr. Sebastián Garcia. I'm the director of the Evidence and Intelligence Department for the Action in Health from PAHO. Well, now we go to our first presentation. I yield the floor to Dr. Oscar Mujica, who is going to talk to us in this first part on the inequalities on the pandemic scenario. Please, Dr. Mujica, the floor is yours. Thank you very much, Dr. Garcia. Good morning to all of you. Special greetings to all the participants, very especially Dr. Rosen, our emerit director, and all those present here, members of the network of our colleagues from PAHO, and all the colleagues interested in the topic of inequality in health in the Americas and also social justice, of course. My presentation is on inequalities from the regional scenario. Really, one perspective. If you allow to me, I want to dedicate this presentation to the memoir in memoriam of Clovis Heitor Tigre, who is the best epidemiologist. Yesterday was the fifth anniversary of his demise. I learned a great deal from him. See in this chart here, there is a gradient, and it's 9,005. It is children mortality in Lima in 1905. It is published on an article that says 1918, and the data is from 1905. See this huge gradient. Now, look at this other one. Here we have the prevalence in racketism in 5 categories according to from the power, the poorest to the richest, then carriers and also schooled performance, and also there is a gradient. They are inequality gradients in Chile in school health, which is on the work of Dr. Salvador Allende, 1939. The social medical reality in Chile, gradients in health or social gradients in inequalities, unfortunately, have been a characteristic that has been historically determined, particularly in Latin America and the Caribbean, but also North America. It is not only the discovery of the gradient, gradient. You can also see in the chart to the left-hand side, this is a historical analysis of 100 years, 110 years, from 1900 to 2010. From 1900, when Pajo is born, the mortality rate in children, how it goes down from 200 per 1,000, 200 per 1,000 to practically 15 per 1,000. That is the average rate in the region. In the red curve is the inequality concentration index on children mortality according to the income. There is a great database of Madison that allows to see it. And you can see the inequality between 1900 and 1950 considerably increased to 35%. And from then on, basically has been steady. We have not been able to reduce the inequality, especially this one, which is the relative inequality, which is only reduced when the speed of the improvements on the social groups in disadvantage overcomes that of the more advanced, those groups with more advantages. If we cannot accelerate those on the ones that are at advantage, the inequality is not going to change. And see, here we see on the right-hand side on the chart, it shows the same thing, but not with the mortality rate, but the per capita income, GDP in international USD, which are comparable and also constant. This is comparable. What we'll do is, in 1 century, as an average, the citizen in the Americas region saw its income to increase from $1,000 to $16,000 in 100 years. The Gini, which is the classical measure of inequality in the income, was not modified. And that resistance to change or resilience is another of the characteristics, unfortunate characteristics. And as we know that the income is fundamental social, economical determinant of health, to the extent that the inequalities are social inequalities as well as income are perpetuated, to that extent, they will continue. The inequalities will continue in health. This I will go very fast, but you know the millennium development of goals. It would, we had success because we were able to reduce in two-thirds the mortality of children, also the incidence of tuberculosis or TB. We were not able to bring down three-fourths of the modern maternity mortality. As you can see in the chart that are shown, in none of those cases the inequality, the relative inequality was reduced. There are concentration curve. There are three graphs from 1990, 2000, 2015. In 25 years, see on the lower left-hand side graph, the 20% of the country with the least development continues concentrating maternal mortality, and more than 40% of the of mortality in children, and more than 50% of the load of TB incidents in 25 years. We have been able to achieve success or regional achievements, and this is replicated without distribution, noticeable reduction in inequality. This is one of the things that I learned from Clover, not only to read, but also to study Rousseau. And in his discourse on the origin of inequality, unfortunately, this sentence fits. To the loss of inequality, the most horrendous disorder happened. At the end, it was impossible for men not to dedicate any thought to this terrible situation and to the calamities that came after it. From COVID, here only to show as a potpourri. Fortunately, we have generated very good evidence, but very reiterative. Wherever we see with an equality lens, we see gradients and inequalities that are deep. Not only inequalities, there is injustice inequalities. What you see here, this is an analysis in Santiago, in Chile, at the beginning of 2020, where we see represented the communes of the big city and ordered from the least poverty to the one to the most multidimensional poverty. And what we see here is that the poorest these territories are in the city, there are a lower percentage of social mobility, the lockdown, the strategies taken into account are not applied equally to people. And usually those who are socially at a disadvantage, as we know today, are the least that could comply with the lockdown. And in the same city, we can see an interesting fact. In the two charts, upper charts on the right hand side, we see the school gradient.
Y del 2020. Lo importante es ver dos cosas. El
2020, what is important is the level, the slope, and of course the general level and scale. What we see in 2020, all the line went up because there were more deaths because of COVID. But what is most important is to see how the slope increases. That is called slope index inequality, which means the excess mortality is concentrated unproportionately in the groups with the least education or on those who have more density, population density. In Lima, this is another potpourri, an analysis that clearly shows there is an excess mortality, but the excess mortality is concentrated unproportionately in the quintile of districts with the least economic poverty in the big port city of Lima, compared with the opposite quintile. In Brazil, this big study, Epic COVID, which was sabotaged, it demonstrated in the first three measurements, successful measurements, in the scale in the incidence of COVID. According to social determinants because of COVID, you can see according to ethnicity, the indigenous people with indigenous identification according to the social economic status, those of the poorest, and according to the insurance capacity or the category of insurance, those who do not have health insurance are those who survive the least. Those are very unjust, unfair differences. In Mexico, the chronic disease load and also COVID. Obviously, there is a gradient by age and also by the presence of different chronic diseases, which we know, besides that, they are unequally distributed, being concentrated in those populations that are at a social disadvantage. In general, in the Americas, it has been translated in very notorious gradients that you see in a very discrete matter in four quartiles on Sustainable Development Index that combines income, education, and health, the three dimensions of sustainable development. The lowest is the sustainable development, higher is the excess of mortality with the score P, and also measured in a continuous manner in the absolute scale in the middle chart, which we call a regression slope. The country with the social disadvantage concentrate excess mortality in the years of the pandemic. And a matter that is very important in our opinion, this characteristic that has to do with the social capital from the social perspective, sociological perspective, is conceived as the ability that the people and families have to get resources according to the belonging or networks or other social structure. From social epidemiology, the social capital, which is fundamental, is the reserve of social resources that are shared and also contextual factors based on reciprocity standard that generate social cohesion, credibility, trust on institutions, and general concern for the well-being of the others. Solidarity, in one word. And what we see here, and it was very interestingly measured, the social capital, group affiliation, civic responsibility, and also institutional credibility. This sounds familiar if we see beyond the figures to the region. Firstly, we see in the chapter, the right-hand side, that the greater this inequality is, lower is going to be the social capital among countries. And on the right-hand side chart, the higher the social capital is, lower the mortality. Or if you want, the lowest the mortality, the higher the risk of death by COVID. In closing, in a more positive note, see this progression in January 2021 to January 2022, but we could show all the months. That is monotonic. It is very interesting. The same information is here in quintiles on the upper part. It is represented in concentration curves along the time. You can see the first one, January 2021, and horrendously unequal curve. And as the time goes by, we're talking about a year, it goes towards the diagonalization of equal distribution, non-equality. And we can see that in two ways. On one hand, on the last right-hand side, we see a blue curve that shows how what we are talking about here increases and how brutally, in just 1 year, the concentration index on health inequality. We're talking here about the coverage of vaccine among countries in terms of COVID. And this is not COVAX, unfortunately. It is not solidarity either, nor the Pan Americanism. It's the political will of each country. They have been able to get, or we have been able to get, that not only increases the coverage of doses in populations of 2 years and older, and which is being reviewed, it has increased above 70%. Simultaneously, practically the inequality has the relative inequality has been reduced among countries. But this is a positive note. It is possible to reduce. Yes, it is. In closing, I tell you, it is possible. COVID is a endemic of infectious disease and inequalities. The pandemic kills inequality. In this book of Claire Bambra, she said that essentially there are four characteristics of this problem. Pandemic kills unequally. Pandemic is lived unequally. Pandemic causes poverty, inequality, and especially the pandemic inequalities are political in nature. As the inequality is produced by human action, Rousseau, the inequality is solved by the product of the human action and the institutions. I had already said this. Oscar Romero had said this. This is a this is a this is what happens when we give instead of give justice. This is the resolution on the Pan American conference in 1 month. 1 more month is going to be shown. The experience has shown that the efforts to reach the people with less advantages, it is not enough to reduce inequality. We need a more comprehensive focus that covers the social gradient, essentially the proposal of our organization with all the countries to retake the path of universal health and the sustainable development. It puts emphasis in 5 strategic lines: the intersectoral action, the reorientation of policies, the community participation of the civil society with an approach, a social cultural approach, the local governance, the strengthening of the governance, local governance, and also monitoring and evaluation. In the 5, integrating equality as a transversal factor. Thank you very much.
Thank you very much, Oscar, for this very complete panorama on time and different places in our region that brings us to understand this pandemic where we have to focus our efforts and our constant work to retake this agenda with a new vision and a new roadmap that will help us respond to this problem in a very strong way. We go very quickly to our second panelist with Dr. Ana Soho on inequalities in the pandemic scenario, a socioeconomical perspective of development. Please, Dr. Soho, the floor is yours. Thank you very much. Good morning. Thank you very much to PAHO and Health Equity Network and the possibility to share this socioeconomical perspective under the lights of the COVID-19 scenario, which is going to be complementary to the presentation of Dr. Oscar, in the sense that it presented very well all some of the ingredients of inequality that are present in this pandemic scenario. I'm going to talk about what has to do with development, and the perspective of development has to consider the zoonotic character of the pandemics. I see that the climate change that has more emphasis or is mostly underlined because we are suffering its effects in a stronger way, does not give us the culture or politic in climate change to the zoonotic character of pandemics. And secondly, I'm going to talk about on how the economic context that the countries are living and the world and our region because of the pandemic, all difficulties are worsened, and this places us in a more complex situation. And finally, I am going to do some references and the need to have to face that the pandemic exacerbates the inequality, the social inequality. First of all, the idea that the development has to consider the zoonotic character of pandemics. The scale of COVID and the magnitude of the biological global risks have really made us consider the need to recontextualize the pandemics that we had kept aside in the 80s. COVID-19 was the first pandemic that goes into a global scale, places us in a new epidemiological era. So this we have the planetary in developed countries and poor countries, and both in more poor countries and medium development, but there is a multiple charge of sickness, and those rich countries were predominated the non-transmissible diseases. These epidemiological interact in these countries due to the entering of a new era. Unfortunately, we know nothing like the virtuality of a pandemic. From here, the perspective of development has to consider the zoonotic character of pandemics, because these pandemics emerge from the diversity of microbes in nature. 70% of the diseases are of zoonotic character, which means that are caused from microbes, from animal microbes that infect human beings. Some of the zoonotic diseases can transform and become pandemics. The most important reservoirs for pathogens are mammifers, especially bats, some birds, and cows. There are many that are still to be discovered, and some who more than half would have the potentiality to infect human beings. So the challenge of pandemics is very strong, which is very well linked to our dependence on the environment, since we are all interconnected. So I've been looking at in readings, and it is not giving in all the documents about climate change. We do not give enough importance to the possibility of emergence of pandemics. This challenge implies that we have to face the human activities that are propellers for diseases, which is changing the natural dynamics of interactions. Pathogens, people, and animals in the intensification of its contact. All the activities that could be disrupting are many. Animal inclusion in the slaughter of for these food chains. They cover as well deforestation, the modification of the use of land, expansion of human settlements, the expansion and intensification of agriculture and commerce, mining, uh, wildlife exploitation, commerce of wild species, and derived products, byproducts. The climate change also increases the pandemic risk because since the climate change forces the displacement of people, but also wildlife is having this displacement that tries to adapt to other types of temperatures in order to survive. Also, we see the displacement of reserves and contact between species that is changing the natural dynamics with the pathogens. So, because of the structural level, the action against these factors caused by the pandemics, we would have to ask ourselves about the interaction and would have to place in the center of the discussions to break the situations that foster this and promote the actions for the perspectives that have been developed in the last decades in One Health of human beings. Now, especially for our countries, if they could make the social investments, not only social, but green and development for an economic reactivation that could consider and act on the pandemic risks, is very important that the countries with less resources and medium could have enough resources to do so. Unfortunately, some of the initiatives, such as the monetary funds last year in order to increase global liquidity with new transfer possibilities and its use, what they do is to bring very little support to medium income countries where 2/3 of the poor people in the world live. And those countries with medium income cover more than half of the Latin American countries. So we have a difficulty in terms of looking at resources and having resources that are going to allow us to have this, to face this challenge. Even more, in the present economical situation that has increased the social effects of the pandemic in this year because of the low economic increase and this acceleration for global economy. War in Ukraine has caused less global dynamism, less availability of food, and increase of energy prices, which increase the inflationary tendencies that were already in place for the clashes of offer, for example, related to the break of value chains due to coronavirus, and the policies for support to the most vulnerable sectors. And in the case of Latin American region, that brought to an inflationary tendency. For the average of the region, the effects are mixed because some of our countries are producers of food, of, but we are expecting a 7% fall in terms of exchange of basic products in our region. In this sense, this scenario of low increase growth, of low growth and increase of the dollar, price of the dollar, and the financial global situation are going to affect as well very negatively our countries. The scenario in this year and in the future is very complex. The CEPAL has calculated for next year an economic growth of 2.7 average in the region, which is lower than the economic development that it has had, that the region had in 2021. And the region is also reaching a regional average that is more than twice the average that we recorded for the period 2005-2009. Oscar already showed us a range of inequalities, a very wide range of inequalities disaggregated at national level, local level, or district level. And the pandemic really increased the problems such as lower investment, high informality, unemployment, inequality, and poverty. In 2020 was launched in terms of employment levels, the worst crisis that we had had since 1950 in the region. The labor market at global level, we were the most affected. The number of employed people dropped 9%, and this hit very strongly women. 46.9% of women employment was reduced. With evaluation of March 9, 2021, and the poverty rates in 2020 reached 27% of people, and extreme poverty 12.5%. The total of poor people went up to 209 million by the end of 2020, 22 million more than the previous year. And it's going to be even worse if the country didn't had failed to implement these important measures. Now, considering the trajectory of this year, the deceleration of the economic activity in the continues to be limited for the recovery of the employment markets in the region. This is very difficult, and it takes much more years to recover the labor markets. And this is even worse for women. So the reduction of unemployment, of women employment, is less than the reduction of the unemployment for men. The rate in the first quarter of 2022, the participation rate for women is really back. This has to do for the decrease of employment for women, and also the care needed developed by the pandemic. I'm going to mention these global shocks get to the several social inequalities that are augmented by that are increased by the pandemic, and represent challenges in terms of governance. We have mentioned already the social democratics, and the public policies have to really be covered by an ethical approach in values such as solidarity, justice, and respect for the social link. This is a challenge from different points of view. The pandemic has provoked a very hard situation for education. The World Bank has calculated that as a result of the closing of schools, so the actual generation of students in the world could uh, be the equivalent of $17,000 million in income that wouldn't be created at global level. In countries of low and medium income, kids who cannot read and understand a simple text after the primary school could go from 51 to 62% as a result of the pandemic. The average of children in secondary, according to the PISA test, could go from 55% to 71%. And as Leonardo Garnier says, if the dropout schools and the education coverage in Latin America, as it happened in the crisis of the 80s, there would be a risk of the for the increase of the levels of education in Latin America. It is then fundamental that the governments and education institution use all their tools to diminish dropouts in school. In the health areas, we have seen that everything has gotten worse because of the pandemic. We have links, new links that are convergent and complementary within politics that traditionally have been treated or dissociated as despair or counterplaced, and has been exacerbated in the scope of the pandemic. With this, public health has to adopt some strategic place in the public and supranational levels and get into a new epidemiological surveillance. This cannot be just given to the states, but also to interaction of the countries at a bilateral scale, regional and international. Countries have to develop a more robust health architecture and some uh, policies that could respond and evaluate in a coordinated way, which implies some demands in terms of WHO at scale of multilateral levels to be more agile, to be able to act in this world that has shown some social, technological, and political changes.
Now, in closing, I would like to say, like Sigmund Bauman, it is so inspiring till his last days. He would relate the uncertainty and the human vulnerability that generates fear, anxiety, with the foundation of any political power. In that regard, legitimacy of the state can be based on the promise of reducing, mitigating that uncertainty and that vulnerability, human vulnerability. Citing him, citing Bowman, because of the magnitude the pandemic crisis could hinder legitimacy of the states if they are not able to mitigate the odious, exasperant, and degrading feeling of being condemned the individuals to loneliness that are in reality are shared and should not be assumed at an individual level. And it is also impossible to do it at an individual scale. The magnitude of the problems that we should have faced in the framework of the globalization have clearly shown the reflections that the national states have to act against them in levels such as marketing and evaluation of risks that have branded our health systems and the relatively disorganized social status and some political status that have brought to a relative discredit of the political matter as a constitution of the social aspects. From there, with managerial responses on a world that have been subjected to such radical transformations have opened venue to populism and chauvinism. Unfortunately, pandemics also have given munitions to efficacious polarizing populist discourses. For instance, the one that is reinforced by anti-vaccine groups, the social explosions in many countries in Latin America within the framework of the most varied political regimes show that moreover social cohesion is uncertain. New social explosions could happen in countries that face even more severe political situation and with least access to resources that allow them to face adverse economic scenarios. This is then a calling to attention on the political challenges that we face, moreover, in an adverse scenario in economic terms as the one that is drawn in 2022. Thank you very much. Thank you, Dr. Soho. We have an important delay in time, so without further ado, I will allow to yield the floor to our third panelist, Jimena Avellaneda, who will talk about the inequalities in the same scenario of the pandemics, but from the perspective of the civil society, undoubtedly a relevant perspective when someone being part of integrating all the necessary analysis to understand this. Please go ahead. Your microphone is off. Sorry. Okay, can you hear me now? Please go on. Okay. Good morning to all of you. Firstly, I would like to thank Tahoe as well as the network to which I belong to have given us the opportunity of having this venue where we, as the title of my intervention says, we are giving voice to the civil society. The advantage of going to the end is that most of the information that I had already prepared, my colleagues before me have approached it in a very, very deep manner. And I would like only to start with a statement that would be that the arrival of pandemic not only put on relief the inequalities that are existing, but also effectively it made them more severe. And on the other hand, this important data that after sub-Saharan Africa, our region is the most unequal in the world. This situation was deteriorated as a result of the appearance of the pandemic, and it is foreseeable that the effects on a long term continue making worse becoming worse if the measures are not taken. On the other hand, I would like to stress that out of the total of the cases that have happened in the world at the global level, 12.77% correspond to our region precisely. Now I go directly to the matter of that Dr. Soho dealt with, and I would like to go deeper, which is the impact on women. Pandemic had a unproportionate, disproportionate effect on women population. We can talk about the feminization of pandemic. It was patent in the whole world, and it contributed to increase inequality, gender inequalities, which have been which have represented a social economic crisis, also health crisis in a permanent manner. We start on the fact that this is one of the sectors of the population where more clearly civil society through organizations and feminist groups, also defenders of human rights, developed more widely the work taking care of the numerous situations, problematic situations. I'm going to make mention only three aspects in which I will deal with. One of them is the mental health, the increase of violence, and also some aspect of the sexual and reproductive health. PAHO has illustrated us very clearly on the role of women as caregivers, which they were at risk of in a greater manner to the infection since they were in charge of patients and they represented 72% of the cases among health professionals, together with lengthy shifts because of the lack of trained personnel, and it has physical impacts on the mental health of professionals on a very strong manner. On the other hand, the workload, the double and triple shift as responsible and in charge of the home chores, also taking care of those ill at home, and in the cases of women who had to adopt the work at home, were more prone to suffer anxiety and depression that more than their male peers. 2 years later, many women suffer the sequels because of the workloads lived in this regard. And so the organization, the civil society, continue developing intense processes of accompaniment and psychological contention that are so important in these cases. Violence. Violence can also be spoken about. We could talk about the fact that pandemic became a pandemic within the pandemic and show the existing fragilities in the social fabric of the region, which were hit by the violence against women. And this disease threatened to erase the progress made in the recent decades in terms of gender equality. And in most of the Latin American countries, significant increases were reported on cases of domestic violence and also the killing of women. This lockdown at home was not safe. Home is not a safe place to protect the life and integrity of women and their children. And many of them ended up, as it happened in the case of my organization, taking refuge in home facilitated by the civil society organizations. In some cases, domestic violence can be said that well, duplicated and even triplicated. It can be generalized to say that most of the victims, and this is not a mystery at all, most of them are women or girls and most of the perpetrators are male. This is the map that I showed here, some examples only on which way the nonsense were increased because of the violences that women were suffering at home. You can see here, this is a comparison on how in Mexico 36% increase happened. We had to implement two emergency lines to be able to take care of the huge number of suits in the case of Bolivia, the case of Argentina, really they are to be taken into account and to worry about because this situation continues happening. In terms of sexual and reproductive health, we could say that the reorganization and prioritization of health services to take care of the pandemic or the emergency left many women without the support that they needed to be healthy. In the region, we consider that 1 out of 4 adolescents didn't have access to family planning services. This we are living that situation still today. A scarcity of family planning services, which is very noteworthy. This exposed them to adolescent pregnancy, also non-desired pregnancy, STDs, and the exposed to unsafe abortion, to school dropout, cycles of bad health and poverty, among others. Pandemic also make more severe the incidence of maternity death, as Dr. Mojica mentioned. The future mothers had to balance fear to contain to affection against the uncertainty to whether they could give birth on a safely manner in a health center. Many of them were used midwives in their communities, and many more simply didn't get the care that they needed on time. In the last 2 years, more than 365 cases were reported in COVID on pregnant women in the region. And we could say those are figures of the Inter-American Bank. More than 3,000 of them died. Also, in our state and in Mexico in general, this was one of the situations that made us worry a lot, and also to note that mortality was almost twofold among indigenous women against urban and suburban women during the period of COVID. Challenges for the civil society. Uh, Challenges from the civil society. The role of the civil society has been fundamental to face this emergency because what we have already seen from the previous presentation, because of the number of deaths, the number of hospitalizations, and the difficulty to vaccinate the population when the vaccines were available. The civil society organizations were very active. The civil society never stopped. It continued taking care of the needs and the problems inherent to populations that having very scarce resources. The creativity of civil society organizations, which is one of their characteristics in the diversity of response to the crisis, clearly demonstrated the different roles that they play in society. On one hand, it is an ally or a partner that are more unprotected, as is the case of women, girls, indigenous populations, African populations. We are always looking for resources, financing, helping the health services, looking for feeding timely and truthful information. Also, we have monitored the compliance of what the states have offered to the population and also the human rights defense. Something very important during the period of the crisis was precisely the monitoring on the demand of transparency and accountability to the states, safekeeping or trying to foresee corruption cases and bad use of the scarce resources. Never the contribution of the civil society had been so needed. The civil society left it clear that physical distancing is necessary. It should not be achieved at the expense of social needs, which is necessary for all of us to be able to overcome the crisis that has not finished yet. Out of what we have talked about before, it is very clear the importance of the commitment of the different participants on society to be able to face the crisis that we consider has not finished yet, and this is the moment of reaffirm the fundamental role of civil society, of the organizations in particular, as a key ally in the case of emergencies, and not only to give recommendations, but also to take into account their strategies and the alternative and creative solutions that commonly are the result of pilot projects that are done in the field. We do not doubt that the first responsible one on the social and economic recovery of the communities is the state itself, the governments by means of their institutions and the programs. What we are interested in stressing today is the importance of acknowledging the strategic alliances, since only that way synergies might be generated with the civil society. And this to be able to achieve collective benefits that are observant of the human rights and respectful of the social rights. I also want to stress that the civil society organizations in the furtherance of their work receive very negative impact, not only on the increase of the demands of the beneficiaries taken care of, but also because of the scarcity of the available resources and because of a certain historical fragility that we have. That's why, in the face of the benefit of the present, the states have to strengthen the presence. And this is a calling that we continuously do that come from understanding that with this experience that we have lived, to value the contribution of the civil society, to value the good practices that we can contribute with developing the capacity and to support in that regard. So the challenges can be overcome and to achieve the compliance of the mission.
I just want to finish with this sentence where we can comment that the call is to have cohesionate societies where the opportunities to progress and to a better life are at the reach of all of the population, and so that everyone could feel part of a common project, a part of an effort, more inclusive effort that could help diminish the present inequalities. Thank you very much. Thank you, Dr. Avellaneda. We have very little time, but we have this extraordinary situation, the opportunity to see how complex is the what we are facing, what we are looking at, and how to establish the route for this post-pandemic scenario. Let's look at some of the comments that the participants can make. We have the part of questions and answers that is activated. So if there is any specific question to our panelists, some of those have already been answered in the platform through by text. I don't see any additional. And I would like to ask our panelists, maybe Dr. Mujica, Dr. Soho, and of course, Ms. Avellaneda, if you could give us a final reflection on the content of what we have heard today, and which would be the key message that you could leave us with. Thank you, Dr. Garcia, very quickly. And you will see it from me. I think that a fundamental subject would be not only to fortify the institutions and its capabilities, but also to make more visible the inequalities with a scientific rigor, and to inform the decision makers with available evidence so that they can generate decisions that are pro-equity. This is something that PAHO and many allies from it, the center collaborator that has been developing this with us for a long time, not only through the use of poll results, and not only the most generalized polls that exist in the monitor of the WHO. This is available information, but many other polls that are available in our countries, and the systematic use of administrative data. All our countries have those that have been disaggregated at territorial level, municipal, sub-municipal, that are not being used with the immense potential that they could have, even if it's incomplete data or if they have some quality problems. It's the best way to improve this information is using the data. And I think it's one of the key messages without recognizing that measuring and monitoring is only one mean. Is not only is the solution. It's not just measuring because, but as long as we can convince or crystallize the decisions, pro-equity decisions, they'll be impossible to advance. Thank you, Dr. Mujica. Dr. Soho, do you have any closing remarks?
Coincido plenamente con el doctor Mujica respecto de la relevancia de estos datos, ¿verdad?
Yes, I agree with Dr. Mujica in the importance of this data. And what I see,
para que esos datos sean efectivamente usados, esos niveles distritales,
these district levels or local levels have to be institutionally fortified, because if there is not an adequate link with the policies, and this is one of the most important aspects of any new surveillance, epidemiological surveillance.
cadena, ¿verdad? Que va desde los
And
puntos más
this is the way we could
hasta
build this chain from the most local place to WHO, so to show you as an emblem.
de allí
And
es importante, dado que los próximos dos
it's
años
important
serán
since the next
ese
2 years,
proceso
this
con
is
la
going to
reforma de
be
la OMS,
the reform of
todos
the
estos
WHO to involve, to include all these ideas.
Desafortunadamente,
I am
muchas
singularly concerned about the
la economía está
politics in our
sumamente
region.
tensionada,
Our
hay
region is
mucha
very
polarización
tense. There is a lot of
y hay
political
mucho uso
polarization, and
populista
there is a great populist
de,
use
de
of
discursos que son anticientíficos y esto
speeches that are
me
anti-scientific, and
preocupa
this worries me a
mucho.
lot.
En el caso de
This is one
Costa
of my
Rica,
main concerns. In the case of Costa
considero
Rica, I
que
think it's
siendo un país que
um,
históricamente ha producido datos muy rigurosos
I know it's a country that has
y
provided good
favorece
data.
los
Now
indicadores
we do not have
adecuados
an adequate
en la
report
trayectoria
on the
del país. Entonces,
trajectory of the COVID in the
me
countries. So
alerta de
these
algunas
are
cosas
little red
que
flags,
yo diría que son
and these wouldn't
denunciables.
be like
Entonces, ¿cómo
yellow
podemos
lights, but
en
they
las
go beyond that.
coaliciones
So
políticas
how could we have
integradas
political coalitions in the region
relacionadas
that
con la
agree with the
universalidad de la salud? Me
solidarity
parece un
and the
desafío enorme que nos
universality of
enfrentamos
health?
en este
And
tiempo.
this is a great challenge that we have to face nowadays. Thank you, Doctor. Dr. Avellaneda, thank you. I would just like to underline what I commented on this role, important role of civil society in terms of the activities and planning, post-pandemic planning, and to take into consideration the what the social security, social that the civil society can give, and sometimes the institutions have a wider or too general vision, and to have some support in this work, local work that is fundamental in order to have a strong base. I also give the word to Dr. Rocio Sainz for final word.
Thank you very much to the three panelists and to you, Dr. Sebastian Garcia, the organization for this activity. I do believe that the different panelists had put at the center of the discussion the topics that we are going to continue working on, that today is like an opening to continue getting deeper in that regard. And I would like to retake two aspects. One of them, the importance on the use of information that is generated from the local towards the global aspect. I believe this is totally fundamental. If the records, the data are not taken for the decision-making process from the local level, it's very difficult for that to feed global decision because there is no care or observance on the timeliness, constancy, permanency of the standardization. So I do believe that this is a totally fundamental aspect. The second aspect is the matter of how to make those decisions to really become that the monitoring feed the decision making process, meaning based on evidence, on the experience, based on scientific evidence, on empirical evidence, and the intersectoral work, as Jimena has placed it, the matter of the incorporation of the civil society and organization from the local aspect. It would seem that it is very clear today the interventions, a lot to work on, a lot of challenges, but we are there. Go ahead and thank you very much. Thank you, doctor. With this, we'll finish answering a question that has been repeated. These will be available on the host channel. We invite you to review it and to comment on it and to be part of it, that we want to build a community within the region of the Americas where we can approach these and other topics that are detected precisely in the building of a shared path in post-pandemic to be able to achieve greater equity and better health to all. With this, I finish. I want to thank the RISE with all the support and the shared work, the panelists with their extraordinary contribution, the whole team that made this seminar possible today, our interpreters that have had a, a role. And we want to invite you to the next sessions on September 27th. We have programmed a seminar dedicated to review the status of the research on inequalities in health, talking about the progress and challenges. And the third seminar that Dr. Science was mentioning, program for October 27th, Thursday, which will be dedicated to talk about the structural determinants that favor equity in health, to talk about the drivers in our region. And the last seminar that will be dedicated, it will take place as a satellite version of the Roy Johnson seminar on the in Colombia. So all of you are invited and summoned and very enthused to be able to participate as a great regional group. So good morning, good afternoon to all of you, and we'll keep in contact.